Hello everyone. I am introducing a new course. This is a 12-week certificate course on palliative care with integrative approach. This course was designed for non-medical professionals, but medical professionals can also attend it. The idea behind this course was to create a working force in the country who can serve the elderly for their quality of life. Because in India, the 140 crore population, people, although we are the young country in the world, but people are aging. In coming few years, the aging population will be higher. With the age, the people suffer from the chronic diseases. And some of the diseases are incurable. So they live with that disease. So living age has increased, but the quality age or the health age has decreased. That is the great problem for the humanity as a whole. But what we can do, this is a natural process. Chronological aging is a natural process. And because of the bad lifestyle, most of the people are adopting or suffering from the chronic disease, non-communicable chronic disease, which is also called lifestyle disease. So first of all, we are taking care to prevent the diseases of our government. Our Prime Minister Modi ji always says in Mann Ki Baat, reduce the use of oil, be physically active, go in the playground. Everything they are saying, people are adopting it also. But because of the occupational problems, because of the work load, because of the lack of desire also, many youth are not going in that direction. So ultimately, after the age of 35 and onward, they get some of the chronic diseases, starting from obesity. Obesity is number one. Then it is converted into hypertension, into diabetes, into heart disease, into fatty liver, and ultimately into cancer also. So this is an ongoing process. That is why we said prevention is very important. And Ayurveda mainly emphasizes on it. They say the main objective of Ayurveda is swasthasya swasthya rakshanam, aturasya vikas prasannam. It means that a healthy person should remain healthy and a diseased person should be treated. For that, Maharshi Charak has given a special emphasis in many chapters. They have developed a Swasthvit chapter. He has designed the Rasayan and Vajikaran chapter. All these chapters are focusing for the wellness of a person. And they very specifically, Maharshi Charak in Ayurveda has designed, there are Ashtanga Ayurveda, means 8 branches of Ayurveda, and 3 of them you may not be knowing. Everybody feels that the taking churan or taking this decoction of herb is Ayurveda. It is not. Ayurveda covers diet, lifestyle, and herbal medicine. And in addition, they have a 4th component, that is the body purification, periodical purification by panchkarma, by fasting, by many procedures. What I mean to say, in the Ashtanga Ayurveda, the 3 branches of Ayurveda, one is the Rasayan, second is the Vajikaran, and third is the Bhut Vidya, which is also called as the Grah Vidya. Grah, I don't know how they have given the name, but Bhut Vidya is the proper noun given by Charak. So these 3 departments are focused for the wellness of the society. You will be happy to know that 90% of the population are healthy. They don't go to the doctor. Who goes to the doctor? Only 10% people. And among the 10%, non-communicable diseases, proportion is now increasing. In developed country, it was already high because the infection rate was low. In India, infection rate was high, but now our healthcare system has taken a good control of infection through vaccination, hygiene, many other steps have been taken. So now we are also, like a developed country, developing the non-communicable disease. Obesity is very important part, which is obviously seen in the society. That is the time when you should control it. The palliative care certificate course is meant for the non-medical people, but who are intended to give their services with the healthcare. In that case, there is a team who controls the palliative care. The head of the team is a doctor. He is a modern medical doctor. But the other people can be Ayurveda expert, can be yoga expert, can be physiotherapist, can be naturopathy, can be a spiritual guru, can be a psychologist, anybody. But you are also one of them. You are going to be a team member of palliative care services. And your role is very important because you are there with the patient and you are going to coordinate between the patient and his family with all the experts, multidisciplinary experts who are there to support the patient. So you know the goal of palliative care is very important, that is give comfort and dignity to the patient. Let him die, let him live with the chronic diseases with good quality of life. But at the end of the life, let him die with the dignity also. That is why the Supreme Court has given a ruling, right to live and right to die. So both the things are there, and your role can be initiated as early as the doctor finds that the patient treatment is not going to be very fruitful, even doing all efforts of the conventional medicine. The moment a physician or surgeon knows it, he should refer his patient to the palliative care. From that time onward, there can be 3 years of life, there can be 2 years of life, there can be 6 months, there can be 1 month of life. At every stage, you as a palliative caregiver can do the service. With these understanding, this course was created because the Ayurveda has a USP, Swasthasya Swasthvatvam. The wellness part is not covered well in allopathy. Allopathy mainly covers the treatment part. And in Ayurveda, we cover the body, the whole body as one entity. All the physiological processes are governed by mind-body relation. So we focus on the mind-body balance. How we focus, that we will discuss in different classes. But to summarize with, we feel that there are the 3 body humors and 3 mental humors. Body humors are Vata, Pitta and Kapha. And mental humors are Sat, Raj and Tam. So all the 6 humors should be in equilibrium so that the mind-body balance must be maintained, which directly or indirectly controls your physiology. And if physiology is disturbed, then only the pathogenesis of the disease takes place. So what is the root cause? Normal physiology maintenance. And in that case, diet, sleep, and lifestyle are 3 pillars. Ayurveda always talks about it, are important. So we focus on that part. So Ayurvedic health management is not only the medicine, number 1, it is the combination of Ahar, Nidra and Brahmacharya management, and this can act as a supportive medicine with the conventional medicine. So instead of fighting with each other, it is the time to collaborate with each other. And for that collaboration, all of you who are attending this course can be a bridge. That's why it is very important for you. I invite all of you to attend this course. If you get proper knowledge, then only you can refer proper person for your patient quality of life. With this, I come to the details of the course. In the week 1, I am going to talk about the foundation of the palliative care. In that case, basically, we will focus the building conceptual clarity and sets of stages in interdisciplinary insights. This week is set to stage by introducing concept of geriatrics, hospice, essential roles in palliative care. It highlights the distinction between rehabilitation and palliative care practices. This is very important. There is a very thin line of demarcation. But you should know what is rehabilitation, what is palliative care. But you should know what is hospice, what is palliative care. You should know where is the treatment part, which is the quality of life management part. That are the things, if you have a knowledge of it, you can implement for your patient. Learn will understanding how to implement palliative care in different conditions, especially by emphasizing elderly patients, because elderly patients have their own problem. And in the elderly patients, if we are addressing their geriatric issues, the quality of life will automatically improve. That's why, but geriatrics and palliative care are different in modern medicine. But as an integrative approach, you can do better arrangement of your patient. In the first week, introducing about the speakers who is going to interact with you for the 12 weeks teaching program. We will talk about definition of the need of palliative care. We will also discuss stages of implementation of palliative care in different stage of disease progression. We will talk about salient features of initiative to initiate palliative care. If the heart failure patient has come, what methods you will adopt to initiate the palliative care. This is the summary of the first week. In the second week, we will talk about the qualities of the palliative caregiver. You are a palliative caregiver. What quality you should have, that will be discussed in great detail. It's very important. If your skill is good, then only you can be good service provider. Otherwise, you cannot give it. So week is focused for your quality improvement. The essence, emotional intelligence and patient reporting skill has to be taught in this week. This week is emphasizing the personal and interpersonal qualities required in the palliative care. Topics such as the patient listening, which is a very important quality of a person, effective communication, method of effective communication, and emotional sensitivity. These topics will be covered in this week. The importance of empathy and understanding the guilt and anxiety of the patient, that is in Ayurveda called pragya, that has to be understood by you so that you can differentiate, you can diagnose the actual status, why the patient is under discomfort. Then only you can plan the services, right? That's very important. And building a report and discuss, prepare comprehensive manner. You have to prepare a report of the patient so that you can refer your patient to the subject expert. The second topic will be integrative approach in palliative care, how it is going to be helpful. We will also discuss effective communication in palliative care, part 1, and the same effective communication in palliative care, part 2. And the fourth lecture is the importance of being a patient listener, focused on pragya, that is the guilt, grief, anxiety, and depression. There are 5 lectures in this week that will be delivered by different speakers. In the third week, we are going to talk about basic concepts of Ayurveda and diet. Because I told you, aharam maha aushadhi. In Ayurveda, diet has been given utmost importance for your wellness. It is not medicine. It is what you are eating, how you are eating, when you are eating, and what amount you are eating. The 4 factors have been discussed in Ayurvedic literature. So we will introduce you with the salient features of this and introducing the diet and spices therapy as a supportive care tools. That is the USP of this class. And here, learners will explore the fundamental principles of Ayurveda and the lifestyle guidance to maintain the wellness and health. They will also give an exposure about the diet, spices, hunger management, and enhancing the quality of life during palliative care. That will be considered. And third, focus on using the food as medicine. That is a very important part of this week. And promoting the compatible diet. Compatibility means what suits you, what suits others. That has to be defined. So specifically, there will be 5 lectures. First lecture will be the basic concepts of Ayurveda. Second lecture will be the lifestyle and good health as per Ayurveda. What is the definition of good health? That will be discussed in this class. Third will be the role of diet and spices in supporting medicine for the quality of life. And fourth is the integration of Western medicine with holistic healing. We will also discuss non-communicable diseases and gut health, because most of the palliative patients are chronically ill. They are the non-communicable diseases, like they are having a stroke, heart disease, hyperlipidemia, cancer. They are all considered under NCDs. In the fourth week, we are going to talk about ethical and holistic integration. This is also very important. This course bridges the traditional wisdom with the modern ethical concern. Because this is the integrative approach of palliative care, you must know what are the USPs of Ayurveda and what are the USPs of modern medicine for ethical issues. This week we will delve with the Ayurvedic ethical dimensions, especially end of the life, what Ayurveda says and what modern medicine says. It examines how modern medicine can be complemented with yoga, exercise, and holistic healing practices. It also emphasizes the integration of physical and spiritual care in aging patients from center home. There will be 5 lectures in the 4th week focused on yoga and exercise and comparative approach in palliative care. Naturopathy, there is a special class of naturopathy, and music therapy and coloring therapy in palliative care, how it can be applied, what are the tools which can be, we have discussed here in this. There are online tools, there are offline tools. Depending on the patient desire, patient choice, we can choose and implement it for the patient quality. Because his mind is distracted from his pain to something else. If mind is diverted, most of the symptoms problem will be solved. That is the basis of all these therapies. We will also discuss symptom management through kitchen spices, part 1. Second is part 2, the same thing. Now we are discussed, up to in week 4, we have discussed the fundamentals of Ayurveda, fundamentals of modern medicine in relation to quality of life, in relation to wellness, in relation to palliative care. Now we are going to talk about symptom management, because pain and discomfort is the main problem in palliative care patients. And what symptom he is having, because of that he is having anxiety, he is having depression, that symptom have to be managed. Then only he will be happy. Otherwise, how can you make your patient happy? At the one end, his disease is not going to be treated for a long time. Up to the end of his life, the disease will be there. But on the other hand, he is having all these symptoms, and these symptoms are deteriorating his quality of life. So our goal is to manage the symptom. And in the symptom management, integrative approach can be a good help to the patient. When we talk of integrative approach, means some conventional medicine if required, otherwise lifestyle change, food change, and Ayurvedic herbal decoction. All the 3 things are included. And they are not only for the symptom, they are for the management of whole physiology. If you are not having sleep, if you are having insomnia, because you have a pain, so pain has to be managed, then you will sleep. Instead of giving a medicine for sleep, we should give a medicine for pain. Similarly, if you are hungry, you will never sleep. The hunger has to be stopped. And in the hunger, if digestion is not good, you cannot eat also. So, compatibility of food as per your digestive power will help to control the hunger. And hunger control can help in controlling your insomnia. So this is indirect path. You have to understand. They're not only focusing the symptom, but focusing the cause of the symptom, which may be indirect. That is very important. And that is the USP of Ayurveda, the holistic approach. So now we are going to talk about symptom management. Initial symptom management strategies are introduced with a focus on accessible remedies like kitchen spices. Kitchen spices are very effective in symptom management. If you know something about it, you can advise the family members of the patient to use them. And if it is effective, well and good. If it is not, then we will go for other alternative options. This week will include the management of complex systems such as dementia, delirium, seizures, neurological issues. It very often happens when the patient comes from the hospital also, post-hospital symptoms like mental symptoms. It's very common. We will talk about that. And emphasizes the place on natural approaches aligned with the patient comfort. What are the natural approaches which can be aligned for the patient comfort? That is important. Basically, there will be 5 lectures in this week. Panchkarma therapy in palliative care, stress, depression, anxiety assessment in the palliative care. What is the method of assessment? The level of anxiety, level of stress, level of depression in the patient or in the caregiver family. And you have to evaluate it. Once you evaluate it, then only you can design the action for the family and the patient. And third is the dementia and delirium management in palliative care. And fourth is seizure management in palliative care. Next, sleep management in palliative care. In week 6, there is also symptom management. This is the segment addressing the emergency symptoms, including hemorrhage, spinal cord compression, respiratory issues. We will learn to explore the sleep disturbances and supravenaceous syndrome, GI issues, and diarrhea and constipation. So these integrative treatment options will help in treating the symptoms of your patient. In this, there will be small lectures which will help you in understanding this. First lecture is spinal cord compression. Second is the introduction to respiratory disorders like asthma, dyspnea, all these things. Third is the symptom respiratory disorders in palliative care and COPD management in palliative care. Then supravenaceous syndrome management in palliative care. Then gastrointestinal symptoms in palliative care. And last is the diarrhea management. Mostly the people start lose motion, and lose motion deteriorates their physical health because the food is not being digested properly, food is not being absorbed properly. So the nutritional deficiency is happening in your body. That is resulting to fatigue, muscle loss, weakness, of stamina loss. So these things are very important. If you control the diarrhea, the body will start healing by itself. And then most of the other symptoms will be controlled. In the week 7, also it is symptom management, addressing on the physical symptoms using integrative therapy. Continuing symptom-focused care this week addresses the nausea, vomiting, constipation, and pain, the most common complaint in palliative care. Basically, there will be 7 small lectures in this week. First lecture is hemorrhage management in palliative care. Second is constipation management. Then nausea and vomiting management. Then focus to hypercalcemia management and hyperacidity management. And symptom management of hiccup, hichkiana in palliative care. That is also a very important part. And the last, pain management in palliative care. Last is the stroke in palliative care. So all these 7 symptoms will be discussed in the 7th week. And next we will come again symptom management, week 4. In this, we will learn about the managing the caregiver stress and burnout. Up to now, we were discussing the problems of the patient. Now we are discussing the problem of the caregiver. Who is the caregiver? First caregiver is the family members. Second, you are the caregiver because you have been working with the patient. So both can have a trauma. Both can have a stress. This stress is perpetuating, they can get a burnout. That is a very serious problem. And we have to manage the patient family also. So we should know what are the problems and how it can be managed. In that case, we are going to learn about the trained managing caregiver stress and burnout, the practical solutions for the patient comfort and the caregiver well-being. Both will be covered in this week 8. There will be 4 lectures. Intestinal obstruction in palliative care. One is the stoma and skin care, which is also a symptom. This is not a symptom. It has been created because the intestinal obstruction, cancer was there, and the surgical intervention has been done, and a stoma has been created. Now the patient is living with the stoma. That stoma is causing the skin problems. Stoma is causing the bad odor. So all these things should be managed properly. We are going to talk about the stoma management and skin care. And then wound care. Most of the patients are bedridden. They develop the bed sore, or their quality of skin is deteriorated. That part has to be discussed. And after that, stress and burnout, part one, it is applicable to both patients and the patient family. We will discuss one by one. In the week 9, the chronic diseases, we are going to talk about what are the chronic diseases. When I say chronic diseases, these are non-communicable chronic diseases. And most of the diseases are incurable in the palliative care stage. So that is also very important. Although the treating physician is giving his medicine, but the prognosis is very poor. In that case, the quality of life has to be managed along with the disease treatment. So how you will do it? You can do it by conditioning the brain to live with those problems. The brain conditioning is very important. That is called yoga and meditation. So focus is the tailoring the palliative strategies in NCDs using Ayurvedic and lifestyle tools is the focus of this week. And focus from chronic illness and how to integrative approach can help your patient. Ayurveda, Panchkarma and gut health strategies will be discussed in this week. And religious and wellness aspect also will be discussed in this week. More specifically, there will be 5 lectures in this week 9. First lecture is stress and burnout, part 2. And these are the skin care in chronic wound and bed sores like that. Palliative care in heart failure. The methods of elderly patient with heart failure. We will also discuss of overview. Interaction method for evaluating an elderly patient and heart failure for palliative care. This was the topic. Week 10 is on different aspects, social and spiritual support in palliative care. This is encouraging the community-centric and spiritual approach for the patient quality of life. That is the focus of this week. Here, we explore the values of community and family in palliative care of your patients. Value of community, value of society, value of your family, all are very important. That we are going to discuss in detail. We are going to learn, understand how spirituality, dietary regimen, and social support system can help in improving the quality of life of your patients. In the end, we are going to study the community participation, group treatment, group healing, it is important. If the patient is living in isolation and patient is living in social setup, makes a lot of difference. What is the science behind that? That we will discuss. There will be 6 lectures in this week. First will be the Alzheimer's disease management in palliative care. Second is the healthcare systems, which is already in place in India. How those systems can be utilized to reduce the financial burden of the family, of the patient, and also to get better services. Because these systems are already giving services, but the society is unaware. Society is ignorant. As a palliative care giver, you should know it and you should get access of your patient and his family member to those existing facilities which is given by the government. So what will happen? Better service will come to your patient and financial burden will also be reduced to your patient. So this is very important. You should know the existing health system in the country. Third is the community participation in health management. And then we understanding the social support system in health management. And then social connectivity, a case study, we will discuss on that. Then family and community role in recovering from the mental and physical trauma of a patient. In the week 11, this is special conditions applies integrative method for neuro and pulmonary palliative. palliative care, neuro and pulmonary. These are the very important part in deteriorating the quality of life. We are going to address that part in a separate lecture sessions. Topic includes the palliative care approach for a stroke, for Alzheimer's disease, for COPD, for psychological conditions like anxiety and stress. These things will be discussed in this week. And creative therapies like music therapy, art therapy, these things also we have, how they are applied and how they are helpful in improving the quality of life. That will be discussed. And emphasizing the tailored intervention in special cases by giving a case example. Basically, there will be 5 lectures in this week. First, the geriatric overlapping non-communicable diseases. The symptoms of geriatrics and symptoms of NCD overlap to each other. So we have to manage both of them together. We will talk about difference in rehabilitation in geriatrics and hospice, and then focused on aging in palliative care. And then a non-communicable diseases, autophagy, gut health, for which Nobel Prize was given in 2016, which is basically the role of lysosomes in detoxification of the body. We have tried to correlate this autophagy with the intermittent fasting, which is very common in Ayurveda, which is very common in different religions, in spiritual beliefs. Fasting is very important issue. And the scientific aspect of fasting we have discussed in this class. So in this way, we are going to talk about the fundamentals of Ayurveda for your wellness. And then food and hunger in palliative care. What is the importance of hunger? And when you are hungry, what kind of food is compatible to you? That part will be discussed. And the week 12, that is the last class, last week of this course, where end of the life management and symptoms we are going to talk. This is a very important issue because you are taking care when the patient is alive for 6 months, for 1 month, or for 2 years. But now he is going to die, maybe within a week, within 10 days. How you are going to care about his death, and how are you going to care about the post-death trauma of the family? That is also very important. The person has died. Now the trauma has come to this family. And your responsibility is not end with the patient death. Your responsibility ends when the family also gets normalized. So we are going to talk about pre and post-death management by palliative caregiver. So this is the addressing the death, dying, and family care through cultural competence. This is the USP of this week. And the final week addressing the healthcare system. And we are going to summarize what we have learned in the last 11 weeks, how the integration of complementary medicine and conventional medicine has been helpful in your study. So we will summarize it in one class. So naturopathy in palliative care is one class, and summary of the whole integration approach in healthcare is another class. There are 2 special classes. Besides that, we will discuss about the grief support and post-death care. There will be 6 lectures in this week. First will be the Ayurveda, ethics, and end of the life care. Second is the understanding the euthanasia. Euthanasia is a condition when a patient is forced to die. It can be active euthanasia, it can be passive euthanasia. That is a very critical issue, and the law does not allow it in India. But in some conditions, it is allowed. A Supreme Court decision has come. Dignity to live and dignity to die. That part has been covered in this euthanasia-linked lecture. Third is the supporting grieving family and end of the life patient. And then post-death care for the family and Hindu religions. In Hindu religion, we are having the 13 days ritual that we call Terahi. For all 13 days, the family members are busy in some of the activities. How these activities can be compared with the modern medicine palliative care terminology, that has to be discussed, because this will validate our old tradition Our old tradition was very scientific. We have given a new language, but the practice was old. That has been different. And then spirituality of social wellness. And so ultimately, we are going to make a overall summary of integrative approach. So in this way, the whole 12-week course will be covered. With this, I end my introductory class, and I welcome all of you to attend this palliative care with integrative approach 12-week course. I wish you best of luck who succeed in getting this certificate after deep learning and deep understanding of integrative approach. Thank you very much.